If your doctor has recommended an endoscopy, you may have several questions. To better understand this process, it is important to know what to expect before, during, and after.
An endoscopy is a procedure that examines the inside of the esophagus, stomach, and first portion of the duodenum, or small intestine, using a lighted flexible tube called an endoscope. The endoscope has a tiny light and video camera on one end. The scope is inserted into the mouth and advanced to the small intestine by your gastroenterologist. A tissue biopsy may be taken at this time to help with diagnosing.
Reasons.
An endoscopy may be done if you have symptoms that are new, cannot be explained, or are not responding to treatment, such as black-colored stools or vomiting blood, bringing food back up or regurgitation, feeling full sooner than normal or eating less than usual, feeling like food is stuck behind the breastbone, heartburn, unexplained low blood count such as anemia, pain or discomfort in the upper abdomen, swallowing problems or pain with swallowing, unexplained weight loss, nausea or vomiting that does not go away. Your doctor may also order this test if you have liver cirrhosis to look for swollen veins called varices in the walls of the lower part of the esophagus, which may begin to bleed, Crohn's disease, or a need for additional treatment for a current condition.
Before the exam, you will not be able to eat anything for 6 to 12 hours before the test. Follow the instructions about not taking aspirin and other blood-thinning medicines before the test. Check with your doctor about what preparation is required for your test. Day of the procedure. The morning of the exam, you may only take high blood pressure, anxiety, and seizure medications. Do not take any other prescribed medications unless you have your physician's permission. Stop taking liquids 6 hours before the procedure. Bring a guest driver for your appointment. When you arrive, please park in the designated area at the Day Surgery Center at Renaissance, which is located at the intersection of Dove Avenue and Leonardo da Vinci Street. The endoscopy scheduling department will call you the day before your exam with your time of arrival. As you walk into the outpatient day surgery at Renaissance lobby, you will be greeted by our admitting staff. If your physician orders laboratory for blood work or x-rays, they will be done at this time. You will then be asked to sit in our lobby until called into the preoperative unit. During preoperative admitting, you will be taken to a private room where your vitals will be taken. All personal items should be given to a family member or to our security personnel. You will be asked to change into a gown, removing all undergarments. A registered nurse will ask admitting questions regarding your past and present medical history, medications taken, and previous surgeries. At this time, you will be asked to sign a consent allowing the procedure to take place, and discharge instructions will be explained, and a copy will be given prior to the procedure. Once all the paperwork is signed, the registered nurse will start an IV.
During the procedure. An endoscopy is done in a hospital or outpatient facility. The procedure uses an endoscope. You will be given medicine into a vein or IV to help you relax. The medication will make you sleepy, so you may not feel any discomfort or have any memory of the procedure. You will be asked to lie on your left side at this time. Then, a local anesthetic may be sprayed into your mouth to prevent you from coughing or gagging when the scope is inserted. A mouth guard is used to protect your teeth and the scope. Dentures must be removed before the procedure begins. The scope is inserted through the esophagus or food pipe and advanced to the stomach and duodenum. Air is put through the scope to make it easier for the doctor to see. The lining of the esophagus, stomach, and upper duodenum is thoroughly examined. Biopsies or tissue samples may be taken through the scope at this time using tiny tools inserted through the scope. Photos may also be taken using the camera at the end of the scope. Different treatments may be done during the examination, such as stretching or widening a narrowed area of the esophagus. The test lasts about 5 to 20 minutes.
After the procedure. After the test is finished, you may feel bloated from the air that was put into your body. This feeling soon wears off. You will not be able to have food and liquid until your gag reflex returns. You should be able to go home 1 hour after the test. You must plan to have someone take you home after the test because you will be dizzy and unable to drive. The providers will not let you leave until someone arrives to take you home. At home. When you're at home, drink plenty of liquids. Eat a healthy meal to restore your energy. You should be able to return to your regular activities the next day. Avoid driving, operating machinery, drinking alcohol, and making important decisions for at least 24 hours after the test. When to call the doctor.
If you experience problems or pain with swallowing, choking, a full feeling after eating a small meal portion, vomiting, fever, loss of appetite, chest pain, distension or swelling of the abdomen, bleeding, blood in your stools, or dark, tarry-looking stools.
Doctors Hospital at Renaissance hopes that this information is beneficial and that you have a prompt and safe recovery. For more information, please call 956-362-2015.
DHR Health Network.